Post-operative instructions. General. Often the after effects of oral surgery are quite minimal, so not all of these instructions may apply. Bleeding. Bite on the gauze firmly for at least 45 minutes at a time after you leave the office. Avoid removing the gauze too early. A common mistake is to remove the gauze 10 minutes after placing it to check the bleeding. Keep it in for at least 30 to 45 minutes with firm pressure to establish a good clot. If bleeding persists after several cycles, place a moist tea bag wrapped in gauze and bite firmly for at least 45 minutes. It is normal to expect a small, scant amount of bleeding for the first 24 to 36 hours. Pain management. Stay ahead of the pain for the first 3 to 5 days. This is important. Take your first pain pill, usually ibuprofen, before the anesthetic has worn off. And then, in most cases, alternate ibuprofen and acetaminophen every 3 hours. Set an alarm and wake up to stay on schedule. This is key to minimize peak discomfort. If prescribed, use the stronger pain medicine every 4 to 6 hours if needed. Always take the pain medicine with at least a small amount of food. This will prevent most instances of nausea. Swelling. Some swelling is normal and can be minimized, but not necessarily eliminated, with the following. Ice pack. Apply 20 minutes on and 20 minutes off during the first 48 hours after surgery. After 48 hours, you may switch to warm applications, 20 minutes on and 20 minutes off. The warmth will help decrease soreness and stiffness. Keep your head elevated for the first few days after surgery by propping yourself up with several pillows. 6 things to avoid for the first 5 days in order to minimize complications. Dry socket. Do not use a straw. This can dislodge the clot and promote dry socket. Do not smoke, as it compromises blood supply and can promote a dry socket. Do not rinse vigorously for the first 3 days, as this can dislodge the clot and promote dry socket. Mild swishing with Paradex is okay. No hot liquids. Lukewarm coffee, tea, or soup is fine while numb. You might burn yourself. No spitting. Just swallow normally. You swallow saliva all day, every day. This should be no different. Spitting can dislodge the clot and promote dry socket. No carbonated beverages. These can dissolve the clot and promote dry socket. Diet. Be sure to eat nutritious food and drink plenty of fluids. If you eat nutritious foods and stay hydrated, you will feel better, gain strength, have less discomfort, and heal faster. Avoid foods that will be difficult to irrigate out of the sockets. Small things such as nuts, sunflower seeds, popcorn, potato chips, rice, etc. that may get lodged in the socket areas. Softer foods, mashed potatoes, pasta, scrambled eggs, are best for the first 72 hours, since the swelling and discomfort will gradually increase and peak at 48 hours. You can avoid the muscle spasms by stretching your jaw back to a normal range of motion. If you had a bone graft or dental implant, you must avoid chewing on that side, as that can cause a failure. Irrigating syringe. This is the most important thing to do following wisdom teeth extractions in order to heal properly. The lower sockets and upper sockets, if necessary, should be kept clean using an irrigating syringe, which we will provide to you beginning on the 4th day after surgery. This means intentionally removing all food particles from the sockets after eating. A common mistake is ineffective irrigating. Irrigating may cause some discomfort or bleeding for the first few days. Allowing food to remain in extraction sockets is by far the most common cause of infection or dry socket inflammation of the bone after surgery. This is usually necessary for several weeks after surgery. Irrigate with room temperature salt water or Paradex. If you have had an implant and or grafting, then you will not use the irrigating syringe in those areas.